Hello, this is your Louisiana chiropractor, Dr. Eric Prather, coming to you from Prather Chiropractic Services in Lafayette, Louisiana. Today we have a second time visit patient, Mr. Drake Ward, in today, and he came to see us for neck pain. You'd had chiropractic care before in the past, all right, but he came across our videos on YouTube. He saw the decompression, the ring dinger procedure, and it kind of instinctively felt, hey, that's something I need. So we did an exam, we did Drake's x-rays, and we found some interesting things. Megan, if you can zoom in. Now, Drake's a 33-year-old male, very young by any standards, likes to run, athletic, likes to cook, got a lot of different hobbies. What we did during his exam of his neck is we found some bone spurs developing at the 4th cervical and the 5th cervical. And what I explain to patients often, when they see bone spurs, they tend to gravitate to the bone spur and fixate on it and think the bone spur is the problem. The bone spur in his case isn't the problem, it's the reason the spurs, also called exostosis, the reason they're forming, which is the problem. And the reason bone spurs will start to grow in a 33-year-old male has nothing to do with his age. It has everything to do with the bad motion of the spine, okay? The bad motion of the joints involved, where you have a disc interacting with a vertebral segment wrongfully. There was what we call aberrant motion. And as a result, the discs and bones and vertebrae, the vertebral bodies, will start to take on these degenerative changes like exostosis. So when a chiropractor sees bone spurs, we look secondary and tertiary to that. Don't fixate on the bone spur. Ask yourself, why is the bone spur growing here and not here? That bone is the same age as that bone. That disc is the same age as that disc. This one has a bone spur, that one doesn't. So it's the underlying dysfunction, bad joint motion, that leads to this problem. We call this, in chiropractic, spinal decay or spinal degeneration. And when we use an adjustment to correct the movement of that joint, we can hopefully slow down that degenerative process, if not stop it altogether. So that's the key underlying purpose of the adjustment, restoring joint motion and stopping those degenerative changes. When you go to a surgeon, for example, he's going to look at the bone spur and say, oh, well, you got bone spurs. It's because you're getting older and we may have to go in and cut those out. Well, you can have bone spurs removed, but if the joint's still moving wrong, you're going to still have other problems going on. So I hope that's pretty clear as to the reason for chiropractic and how chiropractic care intervenes and deals with spinal degenerative changes. So Drake's here for his second adjustment. You got any questions for me before we get started?
No, sir. Let's get it.
All right, let's go. Do our routine. You can go face down right here, Drake. All right, we'll start with the leg length check. Just test to see your general body mechanics. Okay, a little short on the right. We knew that. Let's bend the knees here. Do you feel any tightness in the lower back when we do that?
No.
Drake's got really good flexibility with his running. He does a lot of stretching, does a lot of yoga on a regular basis, which is excellent for anybody to do to try to maintain good joint motion, good joint mechanics. So he's a little short on the right, adjusting that PI. Now Drake presented with some back pain as well, and that went away completely after his first adjustment. But we still got some good correction to make in the neck as well. Good. Big push. Good. All right. Now we're gonna work in Drake's neck here. You can feel this pop up. Now we're getting right into those segments and mobilizing those discs. Alrighty, sir. Go ahead and roll it over. Alright, hands on the tummy for me, Drake. Go. Okay, let's take the horns, put them in the teeth. hands on the tummy, sir. Very good.
That was a good one.
Good release. You got really good flexibility in your lower spine. It's just that, and next where we got to get that work in. Levitation there. Yeah, maintain that flexibility, man. It's pay dividends long term. All right, what's on the menu tonight? What we cooking tonight?
I think we're gonna go with some other pork chops.
Keeping it a
some
little
green
old school,
beans,
huh?
Yeah.
Throw you some sausage in there.
Yeah.
Look at that hypermobility in that elbow. All right, all this is doing well. All right,
Very good.
decompression time, sir. Take the compressive stress out of that C4 and C5.
It's a good one.
All right, have you sit here, right?
Okay. Right there.
Okay, we'll slide you down. Come down. Come to me. There you go. All right, relax the legs. Let them naturally bend as the table elevates. Oh. Again. Go ahead and lift your legs up. That thing's sensitive. Feels your wiggle.
I guess so,
All right, there you go. Get you locked in here. All right, orient yourself to where you feel that settle in the
Okay.
side. Tight squeeze. Locked in pretty good there?
Yes, sir.
All right, Greg. Keep those back teeth touching, okay? Tongue in the center of your palate. Breathing in and out through your nose. Wiggle your third toe. Third release.
Woo! Hello.
We'll get it all the way?
Oh, yes, sir. Woo!
Good. Good. Let it settle in. Felt good. Felt like a good release.
I feel 10 inches taller.
Have that back here. There we go. Good release. A bit more. That's it. Good deal. Good one, man.
Woo!
Good one. Retrain those joints to move like they're supposed to. All right. Very good. Clean out your upper cervical here. Have a seat right there for the chief.
Oh.
Go ahead and extend those legs out in front. There you go. Like to follow up, check his range of motion after the adjustment. Make sure the C1, C2 moving like they need to. A little bit more movement here. Same thing to the left. All righty, sir. Decompress those ears. Oh, good one.
That was a good one.
All right, give me a before and after.
Woo!
Good one, huh?
I highly recommend y'all come do this. Everybody on YouTube, everybody in Lafayette, please come and do this. I promise you, you will feel good.
Good. How is it different from the adjustments you've had in the past with other chiropractors, right?
Well, you know, I've gone to a couple chiropractors in the past, and you know they've done a pretty good job, I have to say. But this is a totally different method of just realigning myself. I promise you, this is not scripted. This is coming straight from me. If you've never felt this before, this is the way to go. This is total decompression of my spine. I literally feel a foot taller. This is good stuff, Doc.
All right, appreciate it. Appreciate
Got
the shout out. As your Louisiana chiropractor, hey, if you like the material, please like and subscribe to the channel. Share it with your friends and family. We're just here trying to do non-surgical non-drug intervention to help people with their pain. Educate them on the problems and challenges of spinal degeneration, spinal decay, and see what you can do with chiropractic to incorporate that into your health regimen. Your Louisiana chiropractor, Dr. Eric Prather. We'll see you soon.